like all nurses, it's been a really challenging time in that, we at the front line of care, and in the context of cancer, we've already got a vulnerable group of patients who are potentially have been at greater risk of exposure to COVID. So it involved for us a lot of education, a lot of support, a lot of dealing with patients who had levels of anxiety that really needed greater support and attention. But I think, and so there was, nurses have played such a critical role because we're at that sort of working with patients that we can help allay such anxieties, we can give information, we can clarify misconceptions. So I think we've played a really important role for patients who've been undergoing treatment and supporting them through treatment. But also, though, I think that one of the challenges we've faced is, patients who've been perhaps reluctant to maybe come for screening, and they've delayed screening, they've delayed visiting for their regular health checks. And so I know that some of our members have done a lot of work at, again, community education and really still trying to encourage patients and working with families to recognise that, you can't, these are still important health checks that one needs to have. So we've had members who really had to change the way in which they approach that education to help support families to manage that. Then understand the importance of looking after their health. I think in many of our countries too, we've, like across the healthcare sector, and cancer hasn't been unique here, but we have absolutely had to embrace virtual care and different models of delivery. And so, we are very fortunate that that technology has enabled us to both provide that patient support, but also, but in some countries, there's some amazing models of where we're actually also doing, able to provide sort of tele-oncology type sort of consultations and services. And so there's been many, many changes to our practice, but probably one of the other things that I need to note here is that the impact on nurses themselves and the working environment and how much this has affected nurses. And I think that it's the pressures, the workloads, the stresses that they have had to face, I think is something that we really will need to pay attention to as we come out of the pandemic.